Hello, hello. We're going to talk about nutrition in chronic kidney disease. How does nutrition affect patients with kidney disease? And what should you, as a primary provider, tell your patients to do? This is a big one. This is a big challenge for us all because the food in America is loaded with junk, junk. And I know you guys know that. So, as providers, we're trying to fight against what the food and drug companies are doing to try to keep our patients healthy. We medical providers did not get a lot of training in nutrition, and so I'm a nephrologist by trade, and I'm a hypertension specialist. I've been practicing 20 years, but all the information that I had to get from nutrition, I had to learn on my own. So I want to encourage you as a primary provider, do your research, do your studying, so that you can be more helpful to your patients. My motto is let your food be your medicine. Instead of taking a bunch of pills, how about eat the right foods and let the food be the medications that you take? Rather than having 8 to 10 to 12 medicines, which is what most CKD patients are on, nutrition is one of the greatest things that your patients can use to try to help their kidneys. If you have a really good diet, you can slow CKD. A plant-based diet is what I tell all my patients. What's the problem with meat? Meat has a high biological value, and they contain all the amino acids, which is good if you don't have kidney disease and you're healthy. You need that. But high protein diets sometimes can increase your intraglomerular pressure and your glomerular hyperfiltration rate, and that sometimes can damage your glomerular structure, ultimately worsening CKD. So let me just review. Just think about it. The ACE inhibitors and the angiotensin receptor blockers lower glomerular pressure. That takes pressure off your glomeruli, and that's renal protective. Well, a diet very rich in meat raises your intraglomerular pressure and causes some hyperfiltration. That in of itself can kind of further progress CKD, further worsen CKD. Meats also cause acidosis. The breakdown of meats increases your acid level, also can cause elevation of uremic toxins and inflammation. Gout. We got a video below talking about gout, so check that out. I'm a nephrologist, and we've created this mini nephrology fellowship course to help you, primary care providers, better take care of your patients. We talk about everything dealing with nephrology and CKD patients, and it's more clinically based. There's 7 modules and a quiz after each module, and we also have a free webinar to give you like an appetizer to kind of reel you in. Hopefully you can check that out. I hope it's helpful for you because I really want to see some transformation take place amongst the primary care community because you all are on the front lines taking care of these patients. So I want you to be totally prepared. Other things about meat, we said it creates acidosis, uremia, inflammation, also increases advanced glycation products. What does all that mean? Well, hemoglobin A1C is a glycation product. Hemoglobin A1C is glycated red blood cells, sugar that's attached to protein. Meat also increases your glycated proteins in your body. It causes oxidative stress and proteinuria. So a diet rich in meats sometimes can work counterproductive in patients who have kidney disease. All that extra acid from meat breakdown and meat metabolism can cause inflammation. So that's another problem. So I tell patients, try not to eat too much meat if you have kidney disease. There's kind of a fine balance. I don't tell patients to go vegetarian, but I do tell patients to minimize the amount of meat intake. So protein in CKD patients, we tell them to eat normal amounts of protein. That's 0.8 grams per kilogram of body weight. Now, if patients on dialysis, those patients have a tendency to have low albumin levels, malnutrition. So we push more protein in that population to try to keep them from being malnourished. We have a lot of studies that show people on dialysis, if they're malnourished, their morbidity and mortality is pretty high. But people who have a normal albumin level, their morbidity and mortality is low. There's actually something called the obesity paradox, which is the gist of it is the fatter you are on dialysis, the better your morbidity and mortality. so, so the big girls and the big guys, when they get on dialysis, they do real well. so, so keep that in mind. That's crazy, but it's true. The fat people do well on dialysis. If you're a skinny old lady or a skinny old man, you don't do good on dialysis. But back to CKD, plant-based protein have less acid. It's easier for your kidneys to metabolize. That's why we recommend plant-based proteins such as tofu, tempeh, edamame, lentils, chickpeas, peanuts, almonds, spirulina. I mean, we just try to tell patients to get your protein from your plants rather than from meat if you can. Now, processed foods is synonymous with being sick. If a patient is eating a heavy base processed food based diet, they will be sick. It may not be now, but I give them 5-10 years, they will start to have diabetes, hypertension, inflammation, joint problems, arthritis, kidney disease, etc., etc. You know, America, we're not the best country when it comes to diet and the additives in our food. So you, as a primary provider, are going to have to help your patients, educate your patients on this issue. Here's a quote from Dr. DeVries, a cardiologist at Gaples Institute in Chicago. He says, ultra-processed foods are clever manipulations of mostly unhealthy ingredients titrated to appeal to common cravings, tasty by design, but it's all a trick. That's something. He says health consequences of ultra-processed foods are dire. He also goes on to say a large study conducted by over 19 years showed a 31% higher mortality for the highest versus lowest consumers of ultra-processed foods. So if you're eating all that junk, you're going to be sick. I don't care who you are, where you come from, how much money you got, what color you are, none of that matters. You will be sick eating processed foods. What is processed foods? Processed foods are foods that you can sit on the shelf and they can stay on the shelf for a long time. They process them so that they won't expire, so that they won't go bad. That's why you have to be careful about eating those types of foods. Now, I know we all eat them. We all like a Snicker bar every now and then. We all like a soda every now and then. But those foods will definitely cause major medical problems in our patient population. So I tell patients to go to the outside section of the grocery store, the vegetables, the fresh meat, and the things that are not in boxes and in cans with all the salt and all the excess processed material that hurts us and harms us. I read another study that says 67% of children's daily calories come from relatively empty, ultra-processed foods. Now that's crazy. That was from another study I read. That's crazy. That much food, that much of a children's daily diet in America is from processed foods. 67%. This is what's causing the obesity and diabetes epidemic in our country. Processed foods increases obesity. Obesity increases type 2 diabetes because it is the number one risk factor for type 2 diabetes. And type 2 diabetes is the number one risk factor for kidney disease. So you see how all that works? Processed foods, obesity, diabetes, kidney disease, dialysis. And this is what we're trying to prevent. So as providers, I want to encourage you to talk to your patients about diet, talk to your patients about food choices, about grocery store choices. If it's not in the house, you're not going to eat it. If you didn't buy it, you're not going to eat it. You know, my wife and I, we try to eat a very healthy diet. We eat a lot of fish, a lot of bird, quail, duck. We try not to eat too much processed foods. We eat a lot of vegetables and fruits, a lot of watermelon, a lot of bananas. And I want to encourage you to talk to your patients about doing this to try to help keep them from having so many medical problems from what they eat. You know, we as primary providers are on the front lines. And I tell you, I congratulate you. I admire you for being in medicine. Medicine is a calling to me. And I love people who think of it as more than a pill pusher. We're not just pill pushers. We're people who are critically involved in a person's health. And so you can be, you know, the voice of reason in your patient's life and the voice of health to help them make changes necessary for their health. So remember this, your health is the most important thing you own, second to your soul. That's my company motto. Your health is the most important thing that you own, second to your soul. I encourage you and check out our video below. We got a free webinar you can check out. We also have a 7-module course you can subscribe to and a community where you can send me questions, a bona fide nephrologist and hypertension specialist. You can send me questions and I can field them real time. So I look forward to just interacting with you all. I look forward to helping you all making some transformations. And I will see you in the next video. Thank you for tuning in.